commemorate the UN International Day of Older Persons. We should support the Universal Declaration of Human Rights regarding older persons. And of course, my friend Ghana Government Pensions Association talked about low pensions, allowances, and incomes. And let me add the recent cruel stab by the government in the retirement income securities and of the elderly due to the domestic debt exchange. I'm sure you've all seen some of our elderly pensioners picketing the Ministry of Finance because the little NOCO fuel they got, they went and put it into government bonds. And all over the world, government bonds are supposed to be the safest investment that one can make because governments normally don't default on their debts. And so this is a novelty. I mean, the trust that our pensioners had and when they put their small inside bonds, today they are suffering because of that. We must ensure that the aged receive their returns on investment, and they must have no cause to worry about their social security and their pensions. To help improve the economic well-being of older people, we must guarantee them financial inclusion by facilitating easy access to microfinance services. It will enable them to save, invest, and access funds for their basic needs and for emergencies. Ladies and gentlemen, ahead of the 2020 elections, I laid out several policy proposals aimed at improving the general welfare of the elderly in Ghana. These policies were well thought through and tailored specifically towards our elder citizens. We committed to establishing a center of excellence for training social workers to care for the elderly and also to reactivating the EBAN elderly welfare card to enable Ghanaians above 60 years to have priority access to social services. For those of you who remember, the Ministry of Gender and Children and Social Protection under my administration introduced the EBAN card. And it was a card that the elderly were supposed to have. And when they went to banks and they showed it, they were given priority service instead of having to wait in the queue. It was also supposed to give them discounted bus fares so that they are charged a lower fare than the average person. And so it was supposed to improve their access to social services. So this is something we're going to look at again when we come. We further promised to amend the National Health Insurance Act to exempt all persons aged 60 and above from paying the NHIS premium. This will remove the inequity that exists currently between SNP pensioners and other pensioners. Because part of the NHIS funding is taken from the contributions of working people on SNP. A certain percentage is taken into the NHIS. So all the working people who contribute to SNP, when they become pensioners 60 and above, they don't pay the NHIS premium. But for those who work in the informal sector and don't contribute to SNP, like our market women, our farmers, and everybody, they are still required to pay NHIS premium, even when they are above 60 years. And so we need to work out this inequity and make sure that everybody who is Ghanaian, who is a senior citizen above 60 years, does not have to pay a premium. Because if they can't pay a premium, it means they cannot access quality health services. The Ministry of Tourism should introduce and promote a senior citizens tourism program. This program will allow senior citizens to visit interesting domestic tourism sites that they do not have the opportunity to visit during their working lives.